Hi, everyone. My name is Nick Turkas, and I am the Director of Patient Education and Community Connections for the Arthritis Foundation. And today I want to talk about Medicare open enrollment. I'm here to provide you with a quick step-by-step guide on how to make the most out of Medicare open enrollment. And if you're dealing with arthritis, you'll have some extra considerations to make. So let's go ahead and just dive right in. First, let's talk about some Medicare basics. And that is Medicare is an insurance plan. It is an insurance plan that has costs and has several different versions. And you're going to have to make some decisions about the type of Medicare that you'll sign up for, and the plan that you'll sign up for may vary year to year based on the type of health resources that you're going to need for every single year. So my next point is that open enrollment is this period in time where we can make changes to open enrollment, or if you're new to Medicare, sign up. And that typically happens in the fall and early winter of every year. November, December, January is the time to sign up and get ready for open enrollment. And when you are getting ready for open enrollment, it's time to take a moment to think about your healthcare needs. What doctors are you going to see? What medications you'll need? Do you need durable medical equipment? Do you have any surgeries that you're planning for? Do you expect to use any allied healthcare like physical therapy or occupational therapy? Make a list of all of the healthcare resources that you've used in the past year and anything that you're going to be using next year. And that's going to be a big factor on the type of Medicare that you're going to want to sign up for 2024. So if you have Medicare right now, again, what worked for you? Was it the right price? Were you paying maybe more than you had expected? Are you getting a good value? Did you have any obstacles when it came to accessing your care? Did you have issues accessing a prescription medication or for a surgery or any of that allied healthcare? Remember, it's not just about the money you spend, but it's also about the time and effort to access those services when and where you need them. Again, you'll also want to think about these resources that you need and match them up with the available plans. There's a lot of different versions of Medicare. So you can check out the Medicare Finder tool on healthcare.gov and medicare.gov. Those are a great place to sort of plug in the types of healthcare that you're going to need. And it will show you different plans, and it will also show you different costs. If that's a little overwhelming, if you have some trouble with using online tools like that, you can certainly call the Arthritis Foundation's helpline at 1-800-283-7800. Or you can check out, there is a state health insurance information line that they have for just about every state. That is a resource as well. But also talk to your doctor, talk to your pharmacist, talk to other trusted health allies to help you make a good decision about the plan that you're going to need. And honestly, one of the biggest decisions that you'll make is whether you're going to use traditional fee-for-service Medicare or something called Medicare Advantage. And without getting into a lot of details, fee-for-service Medicare or traditional Medicare covers doctors and covers hospital stays. But if you want to get extra benefits like prescription drug benefits or help with vision or dental or other services, you're going to have to buy a Medigap plan or a Part D plan. So you may have to buy extra parts of the plan. The good news is that you can use those services typically without limits. If you are signing up for a Medicare Advantage plan, a lot of those extra services are baked in, but there is a extra cost for using them. For both plans, you're still going to pay a premium, but it will just vary on the type of resources that you need is the type of plan that you'll pick. Traditionally, if you are a high user of healthcare, a traditional Medicare plan with Medigap is probably going to be a better savings in the long run. But if you don't use a lot of healthcare resources and it don't expect to for a long time, then a Medicare Advantage plan may save you some money. But keep in mind, once you switch over to a Medicare Advantage plan, it's not so easy to switch back. In some cases, you can't at all. So it's an important decision to make, and definitely talk to some of those experts about what works for you. And I encourage you to, again, call the helpline, check in with those state senior health information insurance programs. We'll put some links in the side these videos to get you some more information. But again, think about the arthritis resources that you need, the Medicare coverage you need. Think about your ability to pay for those services and pick a plan that works best for you and review it every single year. Thanks so much for checking out Arthritis Foundation's Medicare resources.